Assalamualaikum warahmatullahi wabarakatuh. Good morning. Allow me to introduce myself for this venue. My name is Umar Tsani. I'm a lecturer from STTM Cilengsi, Muhammadiyah Cilengsi, and uh, currently I will present a paper which have a topic about developing public health modeling for COVID-19 in Indonesia with machine learning to analyze statistical data. Okay, let's just start. Uh, COVID-19, as we all know, has currently almost 2 years been a pandemic in all over the world, but especially in Indonesia, we can see that during the era starting from last year, early last year, it's really hard to predict, and we are we doesn't know what is gonna happen in the next month or in the following years. The longer the era, then the longer the harder it's gonna be to predict how it's gonna be the outcome. And it's not only in Indonesia, as we can see currently in Indonesia from July to September is getting better, but during the same time in other countries in Malaysia and Philippines, we can see Malaysia, Philippines, Vietnam, Thailand, it's worse than Indonesia for current data, current situation for the last week, like from 19th September to 26th of September, we can see that Philippines, Malaysia, Vietnam, Thailand is worse than Indonesia. It's currently Indonesia is about 2,000, but Philippines and Malaysia is more than 20,000 daily case during the week. So it cannot be imagined at the same time happening because before in early this year, Indonesia is a lot worse than Malaysia, for example, or Singapore, but currently it's the other way around. It's Indonesia is getting better, but other places on other countries in Southeast Asia is worse. So due to the difficulties to predict, scientists around the world actually already created a modeling system called public health modeling, and and for the infectious disease, the modeling is called an SIR, or suspected suspected infected and recovery model. And actually it's based on a relatively simplified mathematical derivation, as we can see here. If we model it on Python, we can see that it's a derivative mathematical model, and using this model we can put simplified uh, graphical analysis, like suspected is here in blue lines, and then recovered with immunity is on a green line, and then affected infected people are in the red lines here. So using this model we can see that um, infected people usually in the middle of the pandemic will have the peak, like usually depend on the what kind of infectious disease is it, like the incubation period and how severe uh, the the disease uh, can get infectious between people, like the more infectious the disease, it will be getting the peak will getting steep, and it's getting more number at the same time, but after that it will also getting better faster also. This that can be derived from the SIR modeling. Next, the SIR modeling can also be superimposed on the real data. So we here superimposing the SIR model into the real data, which we get the data from the government of Indonesia, the official data. It started from February 15th, 2020, up until September, third week of September 2021. And we can see here the real data has two peaks here, which the lower peaks has happened on January, around January to February 2021, and the highest peak on July 28th of 2021. But using the SURF model, a modified SIR model, which includes also the vaccinated model, the fee here is vaccinated. So using the model, we can see that uh, it only modeled only one peak, and this model was developed using the elastic net, and elastic net is a regression model for a couple mathematical functions, and here mostly is polynomial modeling, but the elastic net is has certain characteristic which it can plot between many data, so kind of averaging the data, and it can perform better that way. So this model actually, the surf model here, it's not, doesn't mean that the model has higher incidence of infected people here, because actually this is not supposed to be at the same scale here, but this model is only try to here on the graphic. I'm just trying to put the model on top of the real data, but not on the scale. So this peak doesn't mean that it has a higher peak than the real data. Okay, next. Now we can see the same method applied for the recovery model, for the recovery real data, and this one is superimposed, the model superimposed on the data, and right now we can see that we are using the same scale for the recovery model, and we can see here that the model can average uh, better on the real data, and although it still has only one peak, but it averaging mostly on most of the data. So this one is a better model to reflect the recovery on a daily basis in Indonesia for a national data. So the conclusions for our presentation is, first is that it's still hard to predict the COVID-19 pandemic using solely on SIR model, but it has to be combined with the real data. So the second conclusion, using the real data and using modified model, we can much better the data and predict a better result for a regression using currently the elastic net, and also we can using more advanced modeling using like SVM or deep net neural network to probably predict better for the future outcome of the pandemic. But again, for the regression model on the long term, especially more than a year or a couple of years for next, what are gonna happen for the following years or next years in Indonesia is gonna be need more study and need more better modeling and more a better approach for the data. Okay, I think that's it for my presentation, and thank you all for your attention, and thank you. Assalamualaikum warahmatullahi wabarakatuh.